I have with me today Dr. David Kunashko, trained as a chiropractor, medical director of Meditech, the distributors of the BioFlex laser system, both the professional and the home personal systems, which I actually have both. We use a lot of the BioFlex systems in our clinic at AcuBalance Wellness Center here in British Columbia. And I wanted to have David do a discussion on current research with low-level laser therapy, also known as photobiomodulation, for the public's interest, to let them know where the research is as of the end of 2022. So this is as of 2022, the end of 2022. What's the research saying? What are we seeing around the future? With the idea, hopefully, that you, the public, so many of you are maybe not aware of this incredible modality, that you can start to find where this may serve you, support you, and benefit you. So David, welcome to our little interview here and for public education, and good to see you again. And how about I'll let you kick it off and probably a little review of what photobiomodulation is, or low-level laser therapy, and
Sure.
then start to talk about the research, and you and I will have some good discussions around that.
Yeah, that sounds great, Lauren. I appreciate you having me on today. It is a fascinating topic. I've been involved with it for well over a decade now in the capacity as a clinician and now as a medical director, as you mentioned, at BioFlex. So I look forward to the opportunity. So what I wanted to do today was, for the listeners out there, some of them might not be overly familiar with the terminology photobiomodulation therapy, or PBMT. Oftentimes known as cold laser therapy or low-level laser therapy. So a little bit of an understanding of what that is. And just to review with the listeners what the stats are for research. So it's very well researched. So just so the viewers can understand that. And before I delve into the research, I wanted to talk about some breaking research in 2022 on chronic pain and the use of NSAIDs, which I think for a lot of listeners out there, they're probably not familiar with this research because it just came out, but it's groundbreaking, and it will really make you rethink about how you, want to manage pain, especially acute pain and chronic pain as well. So let's talk a little bit about what photobiomodulation therapy is. It's been around since the 1960s. And essentially what happens is certain wavelengths of light can be absorbed into cells. And these are cells that are inflamed or injured or diseased, have some kind of issue going on. And when you have inflammation, you have inhibition of metabolism of these cells. So in other words, they don't replicate very well. They don't function very well. They're kind of slow to repair. And so it essentially, if this is prolonged, it can lead to ongoing issues. And the mechanism of light therapy is such that certain wavelengths of light, and the research has shown it's typically red and near infrared wavelengths, they're absorbed by certain enzymes or proteins in mitochondria. Now, mitochondria are, of course, the known to produce ATP, or the energy currency of cells. And what this light does is it actually facilitates or increases the production of ATP inside the cell. And this has lots of trickle-down effects. I won't get too much into the science kind of stuff of it, but essentially it'll have an impact on things like sodium potassium pump, nitric oxide release into blood, and then trickle-down effects inside the cell, including reactive oxygen species or free radicals. And these, in small amounts, actually are stimulatory for the production of what's called cytoprotective signaling stress proteins that protect the cell from further damage. So when these cells, these injured cells, now it could be arthritis, it could be an injury, it could be a wound that's not healing, it could be a concussion, lots of different issues there. When you irradiate these injured cells, you start to derive these different benefits, and the cells start to recover. Right. So an example, in a post-concussion syndrome, brain fog, which tends to be one of the lingering symptoms, brain fog lessens or reduces as you treat it in and around that area with photobiomodulation. And that's just one example. So you'll see an increase in mitosis or repair reduction of inflammation, a temporary vasodilation, an effect on the immune system, reduction of edema, reduction of pain or analgesic effects, and repair of tissue. So that's really what photobiomodulation therapy is. Does that make sense, Lauren?
It does. And one of the things where we speculate, we're using it a lot in reproductive health, and there is slowly research coming out in mouse studies. But when you look at this mechanism, like the mitosis and cell replication for repair and tissue repair, the mitochondria of the egg cell is so important. And so these are some of the speculations why we think it may help with that. And inflammation is leads to so many chronic diseases. We know it, in our world a lot with pain, right? But chronic inflammation can lead to a lot of diseases. And so that idea of what they call inflammaging, accelerated biological aging, if you're able to slow down or reduce that inflammation, then hopefully biologically reverse some of that aging and health. And then obviously if you're going to increase blood flow circulation, that's the lifeline of the cell, right? And so if there's poor blood flow to a cell, it deteriorates, there's pain and cell death. And again, I see the immunomodulation too. All these things, my interest with it is with respect to reproductive health, endometriosis, PCOS. So just that mechanism is exciting. And that's why we've talked about the interest of having research on this area. What you're talking about here is so much for like skin conditions and pain, which I'm sure you're going to talk about next based on this mechanism. But I wanted to just share with our listeners, when you see this mechanism, you can see why there's some off-label uses of PBM right now, or as I should say, they just don't have a lot of data or evidence yet on it. But because of the mechanism, people are using this in so many areas. For example, it's only in the last little while that it's been used for concussions, Alzheimer's, dementia, right? Because of this mechanism, if it does this, it should be able to help the cells in that area of the body.
Exactly. And sometimes, people look at it and think it's too good to be true. But when you understand what it's doing on a cell, and of course, cells are similar in the body, this is where you can see benefits. And obviously the root of so many issues is inflammation, right? So if you have another tool that's very safe, no side effects that can mediate inflammation, then it's a win-win for sure. So every year, there's quite a few peer-reviewed published papers on this photobiomodulation. When I search for it, I search for two acronyms, PBMT, or photobiomodulation therapy, or low-level laser, low-level light therapy. And, in 2022, there were about 500 papers that were published. So these are in journals that are peer-reviewed by editors, obviously from different journals, different fields of science. Could be clinical trials, it could be, bench side test tube work, all that kind of thing. So it's pretty well researched. Now, before I get into the photobiomodulation research, I want to share this with the listeners. And this was research published in part out of McGill University out of Montreal. It seems like a very long kind of title, acute inflammatory response via neutrophil activation protects against the development of chronic pain. But really, what these researchers were looking at is to see if the use of NSAIDs, so Aleve and ibuprofen and all these drugs that people just reach to for, especially when they have acute pain, if taking these drugs actually increases the risk of developing chronic pain. You would think that's not auto-intuitive, like you would think, well, I'm taking it to help manage my pain so that I don't have more pain. But it turns out that's not the case. So chronic pain obviously inflicts a huge societal cost. I don't need to kind of remind our viewers on that, but they specifically looked at low back pain and temporomandibular joint pain or jaw pain. For low back pain, it's one of the most frequently reported chronic pain conditions worldwide. The prevalence is very high, as you can see in the numbers there, and it ranks highest amongst all chronic conditions in terms of years lived with disability. So, and of course, the prevalence increases with age. We know our population is aging. I mean, I'm pushing 60 now, and I wake up every day and I'm like, oh, my back's a little sore, right? And maybe, I know, Lauren, you're only about 20 or 30, but as you get a little bit older, you'll realize that you might have a few of these aches and pains as well. So it's a severe burden upon society. And the problem is we don't know a lot about the molecular mechanisms or the underlying transition from acute to chronic pain, right? So once you have one low back pain episode, guaranteed that you'll probably have more, and it may develop into chronic pain scenario. So understanding the whole pathophysiological process of chronic pain is very complex, and it's an interplay between both the nervous system, the immune systems, neuroinflammatory issues of both nerve cells and non-nerve cells alike. And what plays a role in a lot of this are circulating white blood cells or immune cells like neutrophils and monocytes and T cells. Some of you may have heard of these because of COVID and all the talk about cytokine, the cytokine storm, that kind of thing. So these are all what are at play. Now, what happens is the activation of these white blood cells or immune cells, they start to produce certain inflammatory mediators. They're called cytokines or chemokines, other types of lipids or proteases, and they have a direct or indirect effect on the central nervous system and the peripheral nervous system. And they basically are there to help regulate pain. Now, what happens is that the central nervous system, when it perceives pain, it can actually start to perceive pain in a way that leads to something called central sensitization. In other words, when your acute pain is resolved, your body is still sensing signals that there's pain there, even though the problem has been resolved. Now, that's called central sensitization, or oftentimes chronic pain. So, if you sprain an ankle and it's healed, but you still have some lingering pain there, that's not so much because of physiological problem. Oftentimes, that's because of this central sensitization of pain. So that's part of the issue here. Now, researchers, in this study, we're looking at these peripheral blood immune cells and looking to see how they sort of transition from acute to chronic pain, and whether there's a protective effect if the acute inflammatory response is sort of dealt with and resolved to prevent chronic pain. In other words, if acute pain goes from start to finish, do you have less chronic pain? Or if you block the acute pain with drugs, does that have any effect on chronic pain? Does that make sense, Laura?
So David, is it kind of like a non-treatment approach thing? You have an acute injury and you leave it and you let the body do its own course of healing. Does it lead to chronic pain? Versus you have this acute pain and you decide to take the NSAIDs, in this case ibuprofen, which would reduce or eliminate the acute pain, but what is the aftermath? Is there chronic pain? And then you're obviously going to talk about using something like low-level laser therapy, PBM, as the treatment versus NSAIDs.
Right. So NSAIDs, by their nature, they do have a pain relieving effect, but what they target is the pathway, and they block the inflammatory pathway. They don't let it resolve. So it's kind of like, you have the body's role in inflammation is to start it, initiate it, build it up, take it down, and resolve it. If you block it at that pathway, it never gets to that resolution part. And this is what they're essentially finding. So what the results have found is that they hypothesized that if you inhibit the active immune response, it leads to the prolongation of pain. So they found individuals with acute back pain were almost 2 times greater risk of developing chronic back pain if they reported NSAID usage than those who were not taking NSAIDs. They adjusted for age, sex, ethnicity, and so forth. So here's the thing. You hurt your low back pain. You have lots of back pain there, right? Now, if you went to see myself as a chiropractor or yourself as an acupuncturist, TCM practitioner, we would treat the symptoms. We would help to work with that pain, exercises, and all the rest of it. But what we wouldn't be doing is trying to inhibit or stop that inflammatory process. We try to speed it up and let it resolve, right? If you do that, then you have 2 times less risk of that developing a chronic pain than if you just start popping Aleve and ibuprofen. Essentially, that's what that research is about. They looked at both low back pain and temporomandibular joint pain for chronic pain. So what they found was that this acute inflammatory response, of course, it can be inhibited by steroids, or it was also steroids and NSAIDs. And they found that essentially, if you try to manage acute inflammation with these medications, it's counterproductive for long-term development of chronic pain.
So,
So the takeaway
so David, I call this one of my profs used to look at this for like cortisone injections, and I'm seeing this with NSAIDs. He would call that kind of treatment "smile now, cry later." Smile now that you got some relief from this acute pain, but as you just shared, the research is showing that the NSAIDs and the steroids are interfering with the body's natural inflammatory response, which is a healthy inflammatory response. It's part of the healing response. Because I want to share that we think, oh, we should have no inflammation. If we have no inflammation, we don't live. It's about managing inflammation, and it's normal to have some inflammatory responses in the body. And so when you get injured, that inflammatory response is a normal part of the process of healing. Like you shared, Chinese medicine, chiropractic, using low-level laser therapy is supporting that process where we can help with the pain and regulate the inflammation without interfering with it, which I think you're going to talk about. But for our listeners, what's key that I'm hearing from this research is that when we take these NSAIDs or steroids, we're interfering with the body's fully going through the process of healing. So since it interrupts it, you have a little bit of relief in the acute pain, but the pain doesn't go away like it does if you didn't use the NSAIDs. And you said almost 2 times likely to have a chronic pain now.
Yeah, absolutely. So really the takeaway here is that you want the inflammation to resolve. And photobiomodulation, or PBMT, as I mentioned before, is known to directly affect the resolution of neutrophil, which are white blood cells, influx. So neutrophils come in and start the inflammatory process and actually accelerates that natural inflammatory process. So let's say it takes, I don't know, like 5 days for the body to naturally go through this acute phase. If you had photobiomodulation, it will decrease that time frame, but it will still resolve. So it's what you're doing is letting the body's natural ability to go through this and resolve the acute inflammation and accelerate it. So it stimulates this process, and therefore you're in pain for less period of time, as opposed to temporarily blocking pain, which never lets that resolve. So NSAIDs may mask pain temporarily, but actually seemingly increase the probability that my patient or the listeners out there will develop long-lasting chronic pain. So this is really, of course, makers of Aleve and ibuprofen and all these drugs, they don't want to hear stuff like this because it's a huge moneymaker for them. But end of the day, pain is not a bad thing, right? We know that. So you need to work through that pain and let your body get through it, and you're much better off for it.
And you mentioned how this accelerates. So we hear this with low-level laser therapy, that it accelerates the healing process, and you're explaining some of the process. But also clinically, people notice a reduction in pain. So that's because, it's moving the edema, the excessive fluid, which feels uncomfortable, and it's doing other things for other markers to help with pain as it accelerates the healing. So it's not only reducing pain, it's also accelerating repair.
Yeah, and interesting that, of course, I mentioned it helps with that pathway, but this light therapy also seems to have an analgesic effect, a temporary analgesic effect, which is kind of a bonus for helping reduce pain. And of course, as inflammation subsides and lowers, the pain is lessened as well, too. So photobiomodulation isn't meant as a quick one-time pain relief effect treatment. It's meant to be done over a period of time while you have that acute pain or subacute pain or even chronic pain, and it helps your body manage that and sort of resolve it as best it can to move it forward, as opposed to temporarily just sort of blocking it at a certain pathway with a drug. And that's really the net takeaway. Now let's get into photobiomodulation. And Another groundbreaking piece of research that came out was evidence-based guidelines by the by the CDC, which is the Center of Disease Control in the United States. Now, of course, we all know that there's an opioid crisis is still going on. I know we hear a lot in Canada and the United States and everywhere else about how people start taking these medications, prescribed medications for their pain, and then next thing you know, they're addicted, and we know this is a big problem. So the American College of Physicians and Surgeons, along with the CDC, put out new guidelines for their prescribing doctors to take another look at how you can help their patients for subacute and chronic pain without prescribing non-opioid therapies. And interestingly enough, for low back pain, especially, low-level laser therapy was recommended along with things that make sense, like spinal manipulation, massage, mindfulness-based stress reduction, yoga, acupuncture, a multidisciplinary and rehabilitation. So that's what they're recommending, not taking medications, right? So it's important to understand that when you look at how you want to treat back pain, and of course, this would be for other types of pain as well, these are the ones that are shown to have a very high level of scientific clinical evidence that it helps, right?
I love this paragraph because in my practice here at AccuBalance, when somebody comes in with pain, back pain, we're using low-level laser therapy. We're using acupuncture, often electrical acupuncture, so that's there. We do tuina, Chinese massage, and also cupping or gua sha, so a form of body work, massage. Often, I call it conscious work, mindfulness-based stress reduction. So it's nice to see out of that group, we're doing majority of them. And then one of our practitioners, also a yoga instructor, we send them home with stretches and yoga poses. And I think that's why I think we see good results in our clinic for back pain, because it's a multidisciplinary approach, and pretty much almost all these are being used for somebody with pain or back pain.
Yeah, you're the poster child for that statement right there.
Oh, and I should say, I do get back pain because although David says I'm like 20, 30, that's his humor. He's joking. People be looking at me going, really? He doesn't look too good at 20, 30. I'm closer to David's age. So I use my laser on my back too to keep me limber and moving.
Exactly. All right, so let's get into some of the interesting research that's been published. This particular paper was on what's called a meta-analysis or systematic review. And for listeners that maybe aren't familiar with research, this is where they look at a whole bunch of clinical trials, put them all together, and look to see if the results are statistically relevant. So this type of paper has a lot of good statistical power. So if you see these reviews and it actually makes a recommendation, then we know that it's better than just, say, one clinical trial. In this case, they were looking at the use of low-level laser therapy for the treatment of both lower extremity tendinopathy, like Achilles tendonitis, that kind of thing, or plantar fasciitis. So what they did was they looked at a whole series of different trials, and then they looked to examine that. So they looked at roughly 10 trials, placebo used trials, or laser therapy as an add-on trial as well. And what they essentially looked at to see is if laser therapy was in fact very helpful. And what they found was that when they compared with the placebo-controlled, that laser therapy reduced pain for these conditions, right, up to 4 to 8 weeks after the therapy. And it helped to, improve their overall outcome. And most importantly, no adverse events were reported. So one of the things I always like to mention is that, you can have plantar fasciitis treated in many different ways. And a lot of people end up getting injections, right? Or invasive types of treatments for that. And it's probably not a wise thing to do. You're better off doing things that are, non-invasive, and look at the root cause of the issue and try and deal with it that way. So I don't know if, Dorian, if you have some patients that come in, and I'm sure you have with these type of conditions.
One thing, when we started incorporating years ago, photobiomodulation for plantar fasciitis was one of the things that I was so happy with, because how I would treat it before, is I would use acupuncture, where we insert the needles into the muscle areas in the heel, and it's an uncomfortable treatment. It
Oh
was
man.
effective. Certainly, the needle was uncomfortable, but the treatment, people would benefit. And now we're getting that same benefit with the laser. There's only a small percentage where we will combine. We'll need to do both. But we always start now with just the PBM, the photobiomodulation, to see if after 3 treatments, if we see a difference. And if so, we continue that course. And if not, we may add the needles. My patients like it a lot more. The ones that when I first introduced the laser, where they were getting the acupuncture, and then I said, I want to use this as well. They were like, if that is as effective as the acupuncture, I just want that because you feel nothing with the laser, which they appreciated.
Yeah, exactly. Yeah, it's a little bit of sensitive area there at the sole of the foot. This next paper was, again, a review paper or a systematic review. And I thought this would be interesting to share. And it was on mood disorders and photobiomodulation therapy. So, Lauren mentioned earlier that there's sort of some off-label or sort of use of photobiomodulation that's sort of still being looked at, and mood disorders is one of them. But we're seeing enough papers out there that they can pull them together and look at them as an entity. So we're starting to see more and more evidence that photobiomodulation might be effective. So they looked at 16 research trials, so that's quite a few, and notice that they were using infrared, and I mentioned this earlier. So we know that one of the most powerful wavelengths to use is in the near infrared, around 800 to 830 nanometers. They give some other details about the parameters, which I won't go into right now, but what they found is when they reviewed these clinical trials, they found that photobiomodulation can be classified as strongly recommended for moderate grade major depressive disorder and or anxiety disorder. And they've even been looking at things like bipolar disorder as well, though there's still, that's not as much data there. So we're finding, I don't know if you probably know Dr. Norman Deutsch, who's written a couple of New York Times bestsellers. I actually had dinner with him just the other day. He's an expert in neuroplasticity. As a psychiatrist, he's treating a lot of these kinds of conditions. And he's the first one to say, hey, there's not going to be one answer for these people. But when you have a tool that may be able to help with improvement of cerebral function, of helping. And of course, we're talking about depression, anxiety, there's multiple reasons why that's actually occurring, but they're seeing some positive benefits. So I thought this was a really interesting paper that people may not even be aware of.
Yeah, and we've explored this. I use this personally just for brain health. I'm using transcranial photobiomodulation. And what I like about systems like yours that allow you to adjust the frequency, because there are some that are sharing that based on the frequency, so 10 hertz, 40 hertz, where you're putting the frequency, one may be more for anxiety, one may be more for depression, and some are more for brain health. And so it's nice that your systems have that ability to play with the frequency. And I use this for myself, for my own brain health. And I'm curious as the future goes, because I know they're researching, currently research for Alzheimer's, dementia, and then as you talked about, mood disorders.
Yeah, and so this may well be part of that sort of multimodal approach to preventing or because dementia has multiple components, including genetic or hereditary, but there's also components that one can do to reduce either the severity of the onset, or even, if for it to come on, having cognitive decline, because cognitive decline isn't a natural process of aging, right? I mean, it's funny. I listened to a podcast and they're talking about, or maybe it's on CBC, and they're talking about a 100-year-old lawyer, a female lawyer from Vancouver, who passed away in 2021, and she was practicing until the day she died. And on CBC they interviewed her. This is in 2020. Sharp as a tack. as a lawyer, a civil lawyer, no signs of any kinds of cognitive decline with her, and it just goes to show you that's not a normal process to have dementia. So I think sometimes people think, oh well, memory loss, that's just a normal kind of thing. Not necessarily.
I had interviewed Sanjay Machanda, who did some research on photobiomodulation for altered states and meditations, where they looked at monks and using the photobiomodulation to see, I think they were checking their brain waves if they go into that like 40 hertz or above in this meditative state. And they were able to demonstrate in the research that using the laser systems helped them get into that state quicker. So again, maybe for those of us that are looking for that nirvana, maybe we don't have to go to the mountain for 40 years. We can start to use the laser as well.
Yeah, although that does sound kind of nice, but
The mountain. Yeah, yeah.
yeah.
Just to get out. Yes, I agree with you. Give me the 40 years on the mountain.
Uh, this next paper looked at using low-level laser therapy, and they were sort of comparing it to a commonly used other modalities like TENS. I think people know Dr. Ho, the TENS machine. That's what that's referenced, or therapeutic ultrasound in the management of temporomandibular disorder. And TMJ, the temporomandibular joint, and its disorders like arthritis or trauma. If you're in a car accident, there's a high likelihood that you'll develop this problem, and not right away. It comes on sometimes months or years later. I used to do a lot of examinations of people in car accidents for the litigation, and the insurance would always say, oh, that TMJ problem, you didn't report that after your accident, but in fact it typically doesn't come on right after the accident kind of scenario. So they wanted to look to see if how laser therapy compares. So again, this was a systematic review, and I like presenting those because they have a lot more weight, a lot more power than just a simple clinical trial. So they looked at 12 trials, and they looked for reduction of pain, both in laser therapy or TENS. And what they found was that laser therapy in general was found to be much better than TENS. And that laser therapy was proven to be reducing pain better than therapeutic ultrasound as well. So the standard kind of modality for a lot of physiotherapists or clinicians is, and when you get in rehab round, they'll use ultrasound or they'll use TENS, and they may not even be aware of laser therapy. So they concluded that laser therapy was effective in treating temporomandibular joint. And it also not only helped with pain, but also improved in the range of motion or the ability to open your jaw, which is really important because you want to improve the ability to, chew your food and use your jaw in normally functioned ways. So I would imagine too, you probably get quite a few patients with these disorders as well. This next one was a paper on low-level laser therapy for the treatment of discogenic lumbar radiculopathy. Long phrase, but basically this means a herniated disc or disc bulge that's producing pain down your leg into your foot. And if you ever had this problem, you know that it's very debilitating. It can take months and months, if not over a year or longer to resolve. And sometimes when it's really severe, it requires surgery, but oftentimes it will heal, but it does heal somewhat slow. So this is a double-blinded randomized controlled trial. It was done in different hospitals in Pakistan. They looked at 110 patients. Obviously, they had acute lower back pain. They had one-sided or unilateral discogenic lumbar radiculopathy, as I mentioned. And so basically they were looking to see it. They did 18 sessions, and that may sound like a lot, but of course this is a serious problem. You're not going to resolve it in a few sessions. And they looked at the amount of pain the patient was in, their functional disability, their range of motion of their lower back, visual analog scale, which is, how much is your pain from 0 to 10. They looked at something called a Westry Disability Index, which is a questionnaire, and they measured, as I mentioned, range of motion. And here's the information about the ages. This condition is more common in younger folk, 30s, 20s, 30s, and 40s. As you get into older demographics, tends to be less, and that's because the discs start to harden a little bit, and it's less likelihood the inside nucleus pulposus gel pushes out because the disc itself is kind of aging and hardening. So they had different groups. They received laser therapy and conventional physical therapy, like exercises, or just the conventional physical therapy. As I mentioned earlier, they used near infrared. That's the wavelength that is quite effective. Those are just, the parameters they used. And the results showed very good results. Compared to the just physiotherapy alone. So they found that laser therapy proved an efficient adjunct therapy to conventional physical therapy for discogenic lumbar radiculopathy. In other words, they had less pain. I don't know if you can see that there. It shows 7 down to 1. That was the laser therapy group. The exercise group went from 7 down to 2, so not quite as efficient. And you can also, it's a little bit challenging to see there, but you can see that their Oswestry disability index was also better, 17 compared to 21. The lower, the better. And the range of motion was improved 47 degrees as opposed to 43. So overall, if you add laser therapy to conventional therapy, which you should be doing as well, the overall benefit is synergistic. And that's why we tend to recommend using this in combination with other therapies that are known to be effective to get an even better overall result.
Can I talk about that study? Just because you talked about that was 18 treatments. And just to emphasize that, I can think of a few cases in my mind where they had come to me saying, I've already tried laser, it didn't work. And they did like 2 treatments a week apart. And I'm thinking of one woman that was scheduled to have back surgery. So she's had this chronic pain for a while. And we did a lot of treatments, a series of treatments, and her back surgery was canceled. Another woman where she was on the maximum NSAIDs you can take. So she takes them during the day and she needs to take them to sleep before bed because their pain is so bad at night, it wakes her up. And again, like 20 plus treatments, but after close together, two to 3 a week. But after those treatments, she was off all her NSAIDs. Another gentleman with frozen shoulder. So he's tried a lot of things. That was like 30 treatments, right? But now they have full range of motion again. So it's not one of those one and done type of treatments. So it does take multiple treatments to give the body the energy it needs, the light, the photons, so it can convert that and use that for healing. But usually if you stick the course, you're going to see some good benefit.
Yeah, and it's also really education-wise for listeners. When you're having a problem, you may not be an expert in why you have that pain. You just want it to go away, but you need to be realistic as to what caused it, how long it took, and then your prognosis. And so when you're dealing with a disc problem that took probably many years to develop because you weaken the disc and then eventually you get this bulge. And the anatomy and how it heals is such that it's not a quick, recovery, and similar to frozen shoulder as well. So if you're educated to understand what it is you're dealing with, then your mindset or your mental sort of ability to stick with the program and push forward is there, as opposed to just going everywhere and just thinking, oh, I tried that, I tried this. But you need to really stick with the program for sure.
And you do need a good laser system. So there's the dosaging. So how often and how long you're going for. And when I start with anybody, it's usually 2 to 3 times a week for 2 weeks is kind of how we start anybody with pain. And then based on how they respond, we can adjust our treatment. And sometimes it's just 6 to 9 treatments. The other thing is there's some skill experience with the practitioner, but your device, what's the wavelength? Can you change frequency? The power of the diodes, all that matters. If you have skill and you do the right number of treatments, but your laser is more like a PowerPoint pointer, you're not going to get the results. So there's those three criteria of your dosaging, some skill, but I think that's the least of the issue, and then the quality of the laser make a big difference.
Yeah, end of the day, this type of therapy, in the hands of a novice, and they don't understand what it is they're doing, or even what they purchased. Unfortunately, they're not doing a service to their patient. I'm sure you took more than a few months of training to learn what you do, Lauren, and you continue to learn it every day. Similarly, with photobiomodulation therapy, understanding and being educated and having a practitioner that is well trained and well versed in it to understand the nuances and the parameters will have much better results. So that's definitely part of it. But if you don't have equipment that can do the job, then you're definitely wasting.
Yes, and Chinese medicine training BC is for the doctor level is 5 years, not months. So it's many years of training.
Yeah, no, I know that. Exactly. So.
And then lots of training in the laser. And David, you've been a good mentor in that area as well. So thank you.
Pleasure. This next one looked at a fracture or a broken wrist. And it was a triple-blinded randomized placebo-controlled trial using photobiomodulation therapy. So they want to see if laser therapy applied after the cast was removed had an additive effect on the home-based exercise program and rehabilitation. So when talking about distal radius fracture, of course, that's down by the wrist, by the radius. Usually that happens in slip and falls when you have outstretched hands and you fall onto the wrist. That's commonly where we see these fractures, especially in the outerly patient profile where they have weakened bones, and is very common. So they looked at 50 patients that were diagnosed with this. They were randomized to either receive active photobiomodulation or placebo photobiomodulation after the cast is removed, along with home-based exercise program. And they looked at different outcomes. They used questionnaires. They looked at night pain. They looked at consumption of analgesic medication. And they were evaluated after cast removal, and then at 4, 8, 12, and 26 weeks after injury. And they looked at these evaluations after 7 weeks after injury. So what they found was they did 9 sessions of either active or placebo PBMT, along with these home exercises. They irradiated the fractured area on both sides of the wrist and around that wrist area. You can see here that sort of how they approached treatment and sort of, how long they held it. These are all the parameters that they used. And the results showed that there was significant between group difference in scores when they were measuring for all these different outcomes. So essentially, they found that PBMT was safe and effective for long-term positive effect on pain and disability when applied in combination with home-based exercise programs. So in other words, when you add on this type of therapy, it helps these tissues recover. Now, bones take a while to recover and repair. Even once the cast is removed, there's still healing going on. There's still pain going on. So if the client or the patient has something to use to help manage that, not just with exercises, then it can be very beneficial. So we are starting to see the use of photobiomodulation for fracture repair and fracture recovery, and there's now more and more evidence to support its use. This next one is a common condition, carpal tunnel syndrome, and they want to compare that to a very common medical treatment or corticosteroid injection, and they want to compare the two. That's pretty invasive, and corticosteroid injection, in my experience, it can have some benefit, but usually it's short-lived. Oftentimes there's no benefit perceived by the patient, and multiple injections can actually do more harm down the line. So, as far as I'm concerned, it would be one of those last resort kind of, things, and I would typically not recommend it because of that. They looked at 87 patients, 143 wrists. So some of these patients had it bilaterally or both wrists. and it was moderate carpal tunnel syndrome. And they were either randomized into the corticosteroid or the laser therapy group. And they showed what they did here. Laser therapy was applied 5 times a week for 3 weeks, so 15 sessions, or patients received a corticosteroid injection. And they looked at numbness, because carpal tunnel syndrome can produce numbness, especially around the thumb and the thenar eminence. Of course, there's pain. They also looked at specific orthopedic tests called the Tinel and Phelan's test, which is sort of where you put your wrist like this or the opposite like that to induce symptoms. They also did EMG studies or electrophysiological tests and MRI evaluations. So it was quite objective with respect to what they were looking for, not just does it hurt more or less kind of thing. So essentially what they found was that when they completed the studies, the VAS, or the visual analog scale, and the DASH scores, which is a series of questions about improvement, were initially better in the corticosteroid group in the first month, but then there were no significant differences between groups in the 6th month. When they looked at strength tests and the other tests, and motor distal latency improved significantly and similarly in both groups in the 1st and the 6th months. So in both groups, they found the median nerve intensity rate and what's called the pulmonary spring rate improved significantly after treatment. So what this is showing is that, based on this study, is that they both showed improvement, but when you look at the sum of the parts, that's invasive. Corticosteroid injections are invasive and potentially, let me back up a bit there, potentially damaging. So they're finding that you can use a non-invasive, no side effect treatment like light therapy and have similar and sometimes even better results than a corticosteroid injection, right? Which is potentially, you have a risk of infection or other issues as well. So, this is the type of information that I think even general practitioners, medical doctors need to be aware of, and physiotherapists, when, the standard of care might be, let's have an injection, where they haven't even tried laser therapy. And the research is showing that they'll have benefits as good as a corticosteroid injection. This next study I thought was really fascinating, and one that I'd never seen before, but it talked about the effects of photobiomodulation on maximum lip pressure. And you think, why would they be doing that? But think about people recovering from strokes, for example, people that have neurological damage, could be trigeminal neuralgia. I don't know if you remember or not, our famous singer Justin Bieber had Ramsay-Hunt syndrome. Do you recall that news, Lauren?
I do, and I'm thinking of the lip pressure as well, like Bell's palsy, where they don't have the ability to blow with their lips.
Yeah, so that's where it has clinical significance. Now, there's a muscle that surrounds the lips. I'll show you a picture of that later soon, called the orbicularis oris. And this is the one that allows you to help to articulate in speech and talk and chew and swallow and breathe, all those kinds of things. So when you have alterations in this muscle, it can affect all these different basic functions, that are important for recovery of these types of conditions. So, if there's something that can help with the function of this muscle in a non-invasive, safe manner, then it might be helpful in the recovery or rehabilitation of these patients. So this was a randomized triple-blinded study. They looked at 23 women and 17 men. You can see the age groups here. And the maximum pressure was assessed using something called the Iowa Oral Performance Instrument. I'll show you a picture of that. Essentially, it's an instrument to measure the pressure induced by this orbicularis oris muscle. Again, they used near-infrared wavelength, and they applied it at 6 points around this orbicularis oris. So that's what the actual measurement device looked like. And you can see that's a picture of the orbicularis oris muscle. And you can see those are the points that they treated around this muscle group. And so essentially they did procedures to evaluate after laser application. And they found that lip pressure increased significantly only in the group that had 7 joules of energy. So they were looking to see how much energy would be the sort of optimal amount that would be helpful. And that's important because, we talk about parameters and understanding how to use the equipment is part of its dosaging. And if you don't have enough, you don't get a result. If you have too much, sometimes it's also not good. So this research is really beneficial in guiding the clinician and also guiding in manufacturers and people like ourselves that deal with this equipment to guide the use of our equipment to get these kinds of results. So essentially they found that using laser therapy with this dosage promoted improved performance of this muscle with maximum pressure task. So again, it will be helpful for these patients in recovery of having issues. This next paper I thought was also interesting because there's been a lot of research lately about using photobiomodulation for the recovery in athletes post performance or training. So in other words, things like delayed onset muscle soreness, for example, recovery after you run a marathon or a 10K or just go out for your run, you'll have sore muscles and, might use cryotherapy or you might go into a hot tub or there's different ways, or sometimes you just put up with it. But there's a lot of research lately that's shown that laser therapy can actually be very helpful in the recovery. So what they did was they looked at a whole series of different clinical trials. So again, it was a meta-analysis of randomized controlled trials. They looked at 24 trials, so quite a few. And they looked to see if application of laser therapy improved strength and improved reduced soreness using decreased soreness index. And they also looked to see if it helped with blood markers of muscle damage, creatine kinase, for example, because when you use your muscles to train, you get some micro tissue damage. And when you look at the blood, you'll see a spike in creatine kinase, for example. So they looked at all these different measures. And they also looked at things like VO2, which is your lung capacity. All these different things were looked at. And what they found when they looked at all these different papers, is there's definitely a therapeutic effect of low-level laser therapy for muscular performance and recovery. Now, they're still trying to figure out the proper dosaging, although there are some guidelines out there, but it's still being looked at to see what are the best ways of using this. But in the context of an athlete trying to recover, whether you're a professional, semi-professional, weekend warrior, whatever, this is a type of science that shows, hey, if I had something I could just throw on my muscles, we talk about our personal therapy system device, then it will be very beneficial. And the science is showing that it will be very beneficial in helping you recover from these types of issues.
So when I see this research, it means I don't have excuses anymore for not working out because I don't want to feel sore, because now I have a solution. And my son who plays hockey and rugby, we have the home system, and I see him often before and after his hockey, he puts him on his quads and his hamstrings. Again, because we've shared this kind of information, this discussion in our house. So he's always looking for any edge for him to be able to work out harder and have that recovery.
Exactly. So that, Lauren, that's just a little snippet of some of the research, the recent research on photobiomodulation. And I tried to sort of give a lot of different sort of, uses of photobiomodulation for different conditions and so forth. And, I think to date, there's, maybe 12, 13,000. I can't remember the number of published papers now on photobiomodulation and laser therapy. And every year it's growing and growing. So as a therapeutic tool, I think it's really important that clinicians and people out there know it's evidence-based. There's lots of good clinical research trial to support the use of it, and it's safe. there's no side effects. And that's the biggest thing, right? You mentioned about acupuncture. While it's very safe, there's some risk involved. And sometimes people can't tolerate needles, or they needle phobic, or what have you. As a chiropractor, I get people in saying, just don't, I don't want manipulation, or don't touch my neck, or whatever. So I need some other tools there, right? So
exactly. And it's having those other tools. And we saw in the earlier research when the CDC put it out, the multidisciplinary approach. And so we're able to do that, combine this with acupuncture, with massage,
right.
the lasers. And we have people that are needle phobic. And so we're able to help them using laser acupuncture and then just PBM as its general use that you discussed. I thought this was great, David. I wanted to share some of the research that's come out in 2022 that's quite relevant, and focusing here, a lot of it is on the pain mechanism. And so thanks for sharing this stuff. I thought this was wonderful.
Yeah, my pleasure, Lauren. I look forward to our next little chat.